Hi, this is Matt with Vault Insurance and Investments. Today we're going to talk about Medicare, Medicare Supplements Part D, and Medicare Advantage. Part A is your inpatient services at the hospital. If you've paid into Social Security for more than 10 years, your cost will be $0, 7.5 to 10, $277, less than 7.5, as high as $413 a month. Part B is going to cover your outpatient services, office visits, checkups, things like that. And that's going to run an average of $109 to $134. And that's assuming your income as a single person is less than $85,000, as a married couple, less than $170. If it's over that, you could pay as high as $428.60 for Part B. And this is based on 2017 numbers. Now, Medicare, you do want to sign up or verify your enrollment with the Social Security Administration. When in doubt, don't hesitate, give them a call or hop by their office. If you're still employed, you want to check with your HR department. This is very important. I'm not going to get into all the details there, but you do want to check with your HR department. Now, Medicare Supplements. Medicare Supplements act similar to an umbrella policy. And by that I mean they're going to cover the same things that Medicare A and B cover. If there's something over here that Medicare does not cover, it's not going to pick that up. It's going to pick up and help you with your out-of-pocket cost, your deductible, your coinsurance, your copays, things like that. Here we have a list of all the Medicare supplement plans, A through N. Just because you see it here does not mean it's available in your area. You want to check with your insurance commissioner just to see what is available in your area. The nice thing about supplements, also known as a Medigap plan, same term, is let's say you have Plan F with Carrier X. It's going to have the same coverage you see here with Carrier Y. So when you call your doctor up, you don't say, hey, doctor, do you take Carrier X or do you take Carrier Y? Really, what you do is you just call him up and see if he takes Medicare patients. If he takes Medicare patients, then he is taking your plan. Now, so the pros, Plan B through N in particular, you can change at any time. You're not subject to that limited window. And the network. So like I mentioned before, you're going to call your doctor up and say, hey, do you take Medicare patients? If he says yes, you can see him. And again, nationwide. If not, then of course, no. Now, this does not apply to what are select plans. We're not going to get into that. We're really just talking about B through N supplements. The cons to Medicare supplements, no bundling. So by this, I mean you have to go get a separate Plan D. We'll talk about that next. You have to get a Plan D for your drugs. They're not going to bundle them together. And the cost for a Medicare supplement can be higher compared to a Medicare Advantage plan. Now, Medicare Part D. D is for drug. You got your open enrollment window between October 15th and December 7th. If you do not have a drug plan because you're not taking prescriptions, and then you sign up for it later, there is a large penalty. You want to, I'll put a link for that penalty on one of the links below. So you do want to sign up, otherwise you do have a penalty on the premium. Medicare Advantage, pros, 0 to lower premium cost, so you get a lower cost, potentially, depending on the plan, of course, and they do bundle things together. Now, when they bundle it together, though, this is what you get. You can't pick and choose what's bundled in there. You can't pick your own drug plan. So, for example, on the supplement, when you go to the CMS website, you can plug in your drugs, tell them exactly what you take, the milligrams, tell them what pharmacy you go to, and it'll sort by your lowest out-of-pocket cost for the whole year. Beautiful. You can pick the best plan, that's available for you. When you do an Advantage plan, you are going to get, whatever they bundle together. But again, the pro being lower cost, and it's one payment. You don't have to make multiple payments. Medicare Advantage cons, the bundling can be a negative. Again, mentioning that, you're going to get what they give you. The networks are going to potentially be smaller, especially if it's an HMO. The PPOs are larger. But even the PPO networks are going to be very regional. And of course, you have to pick your plan between October 15th and December 7th. So in summary, Medicare A and B. A is inpatient, B is your outpatient services. Medicare supplements cover the same thing. They cover the same things that Medicare covers. Covers your out-of-pocket costs. Part D covers drugs. Medicare Advantage bundles things together. That is it. There's a lot more to Medicare and Medicare Advantage and Medicare supplement plans, of course. But if you have any questions, give us a call or reach out to us. If you do like the channel, please like and subscribe. Thanks for watching and have a great week.